Good morning, everyone. My name is Claudius Isfan. I'm the public health educator here at the Cook County Department of Public Health Tobacco Prevention and Control Unit. I welcome all of you and thank you for joining us this morning on Friday, the May 11th. I just want to mention that the Cook County Department of Public Health is dedicated to reducing the burden of tobacco in suburban Cook County by increasing tobacco cessation opportunities, decreasing harm from secondhand smoke, and protecting our youth from initiating. I would like to thank the Public Health Law and Policy for pulling this project together. I also like to thank our funders, the Illinois Department of Public Health, for allowing us this opportunity to conduct these type of webinars. With all that said, I would like to hand it over to Leslie now.
Great. Thank you, Claudius. Good morning, everyone. I would also like to welcome you to our webinar. Today's topic is smoke-free multi-unit housing, coming soon to your community. And this is second in a series of 2 webinars. So we also had a webinar last week about creating smoke-free recreational areas, which will be available to everyone who attended today's webinar as well. As you heard from Claudius, today's webinar is being sponsored by the Cook County Department of Public Health. My name is Leslie Zellers, and I'm the Director of Programs at Public Health Law and Policy, and I'll be facilitating today's webinar. Public Health Law and Policy is a nonprofit organization that helps communities pass laws to make the healthy choice the easy choice. In the area of tobacco control, we've helped dozens of communities limit exposure to secondhand smoke or require a license to sell tobacco. You may also know us from our work on policies to help communities increase options for healthy eating and active living, such as banning new fast food restaurants in a particular zone or opening up school grounds for the community to use after school hours. Because we're lawyers, we have a bit of fine print. This disclaimer says that we are providing general information today and not any legal advice along with this webinar. So let me tell you a little bit about the agenda for today's webinar. We'll be learning about the importance of smoke-free multi-unit housing. We're also going to learn about how creating smoke-free housing is legal and various approaches to creating smoke-free housing. Finally, we're going to hear about the experience from Oregon with smoke-free housing. I want to let everyone know that your phone line is muted, so you won't be able to ask questions by phone. If you have any questions, please type them into the chat box at any time. You should see the chat box in the lower left hand of your screen. And we're going to answer your questions after each speaker. Finally, a reminder that today's webinar is being recorded. You'll receive a link to the recording for the webinar as well as the slides in about 2 weeks. And we'll also provide you with a list of additional resources. So next, let me tell you about today's speakers. First up is Robin Salzberg, who is a consulting attorney with Public Health Law and Policy, and she specializes in current and emerging legal issues involving exposure to secondhand smoke. During the last 7 years, Robin has developed model ordinances, written fact sheets, offered trainings, and provided one-on-one technical assistance to public health advocates to successfully advance the goal of reducing exposure to drifting secondhand smoke. Next up, we're going to hear from our presenters in Oregon, Diane Lauder and Kylie Mina Johnson. Diane has a master's in public health and has worked on smoke-free housing for over 7 years. For the past 4 years, her firm, Health Insight, has had the contract with the Oregon Health Authority to coordinate smoke-free housing statewide. Diane develops materials and tools for property managers and community associations to adopt no-smoking policies and provides technical assistance to county health departments throughout the state. Kylie also has a master's in public health and has been working in public health advocacy, training, and technical assistance for over 10 years. While at the Oregon Public Health Authority, Kylie coordinated community and tribal tobacco grants to 34 county health departments and 9 federally recognized tribes. Kylie worked with grantees to promote cessation in the quit line, implement health systems change, reduce exposure to secondhand smoke, and reduce initiation of tobacco. Recently, Kylie led the development of a highly successful smoke-free multi-unit housing and tribal housing initiative, which became a national model for changing norms around smoking in homes. At this time, I'm going to turn it over to Robin Salzberg to get us started.
Thank you so much, Leslie, and good morning, everybody. So to get you some practice with using the chat box, we're going to what we call warm up the chat box. And what I'd like you to do is type in to the chat box your answer to this question. What type of housing would you like to make smoke-free? Is there an apartment complex in your neighborhood that you're looking at? Are you looking at a certain type of public housing, subsidized housing? So to type in the response, you're going to go to the lower left-hand box on your screen, and there's a very faint set of words saying type message here. Put your cursor there and type in the answer and then click send. And when you do this, you'll be able to see your response. All of the co-presenters will be able to see your response, but the other attendees will not. So I'll be reading out the responses to you. So it looks like someone is saying that they'd like their apartment building to go smoke-free. A senior living facility, condo complexes, another person who wants their own apartment to go smoke-free. Great, this is super. So thank you so much for warming up the chat box. All multi-unit housing, whether apartments or condos, senior living facilities, great, great. And we'll be talking about all these things. Private independent apartment buildings, great. Thank you so much. Good responses. The other thing that we'll be doing today is, since we're not all in the same physical space, we'd like to get some sense of what your thoughts are about smoke-free housing. And to facilitate that, we can do some polling. And on your screen right now, you should see a question. It says, what do you consider the most important reason for multi-unit housing to go smoke-free? And this is from a public health perspective. What do you think is the most important reason to make multi-unit housing smoke-free? And you'll see some options there, and you can actually go to your computer screen and click on one of those little buttons, whatever you think is the most important, and it's only going to let you choose one answer. And then you click Submit. And it looks like we're getting results in, and I'm going to let another couple seconds go before we close the poll. Okay, I'm going to go ahead and close the poll so we can see the results. Wow, okay, so it looks like the most important reason from a public health perspective to go smoke-free in multi-unit housing is to prevent exposure to secondhand smoke. Another reason that got some votes was to reduce damage or cleaning costs, and then there's an other, so that'll be interesting to find out what the other is. So I'm going to go ahead and run through some of the important reasons for going smoke-free. And first up is eliminating drifting secondhand smoke. And that was our poll winner today. And as many of you know, secondhand smoke can drift into neighboring units through open windows like this illustration is showing. Somebody's smoking on their balcony or patio, and the smoke drifts into the neighboring unit. It can also infiltrate under doorways. If somebody is in a common hallway and walking by, the smoke can drift into a unit. It can also be exchanged through shared ventilation systems. So if they are on the same air conditioning or heating system, the smoke in one unit gets sucked up into the air conditioning or the ventilation system and gets pumped into another unit. The other thing that I was really surprised to learn about was that secondhand smoke actually can flow through all sorts of cracks and small openings that are left during construction, say around the plumbing pipes or around the electrical wiring. There's actually holes that are not covered up. They're not completely sealed. They just have a plate right in front of them for effect to make it look like it's sealed. But secondhand smoke actually can drift through that way too. And I'm sure that some of you on the call are already getting calls from people living in apartments or condos saying, my neighbor smokes and it's coming into my unit. What can I do? And people across the country are working on smoke-free housing. And they are starting to do surveys of tenants to see how many people are really being affected by this. And across the board, about 50% of tenants say that they have experienced drifting secondhand smoke. Owners and operators of multi-unit housing are also having complaints about this, and surveys show that landlords, their number 2 complaint from tenants is drifting secondhand smoke. So it is a problem out there. Just to let you know, number 1 is cooking odors. That's what landlords get the most complaints about, are cooking odors. So because I mentioned these cracks and small gaps that are in buildings between units, there were some studies done to figure out, well, what happens if we just go ahead and seal these up? Or could we do some sort of air purification system and filter out the smell and the chemicals? Well, they did a study of different types of apartment buildings and did try and seal up the cracks and gaps. And what they found was, 1, it was not very effective, and 2, it was very expensive. So that didn't seem to be a very good solution to the problem of drifting secondhand smoke. The other thing is with air purifiers or ventilation systems, these aren't actually designed to filter out the toxic chemicals that are in secondhand smoke. They can reduce some of the haze, the particulate matter. They can eliminate some of the smell, but they weren't designed to get rid of the chemicals that cause the health hazards. And the U.S. Surgeon General has acknowledged this, that what's necessary to protect people in indoor spaces is to completely make them smoke-free. You can't protect non-smokers from secondhand smoke by trying to create a smoking section and a non-smoking section, by filtering the air. What you need to do is to set up smoke-free policies. Another reason to go smoke-free is to reduce fire risk. And the primary cause of fire-related injuries and deaths in the home are cigarettes, cigars, and pipes. They are left burning and the fire starts, and neighbors or friends are usually the casualties in these sorts of fires. So it's very, very tragic. Another reason, and this was a result in our poll, was to reduce costs, reduce turnover costs. So when landlords have to renovate an apartment before they re-rent it, they can spend hundreds or even thousands of dollars repainting, replacing carpeting and drapes, repairing the burn holes in countertops and floors from cigarettes. And there was actually a great study that was done in New England in their housing authority, and they compared the costs of rehabilitating a unit between a non-smoking unit, a unit that had been lightly smoked in, and one that had been heavily smoked in. And the cost differential between the non-smoking unit and the lightly smoking unit was about 3 times. So for a non-smoking unit, the average cost was $560. For a unit that was lightly smoked in, it was $1,800. And for a unit that was heavily smoked in, it was actually 6 times as much, or up to $3,500 to refurbish the apartment. So when you're running a business, this is a significant cost, and if you could avoid it, you'd be able to have a better profit and have this money go to other things to improve the living conditions in the rental units. So this all sounds great, right? There doesn't seem a reason not to go smoke-free, but is it legal? And that's a question that we get all the time. So I'm going to go over 3 of the most common questions that we get, and that is, number 1, is there a legal right to smoke? Number 2 is, does a smoke-free housing policy violate a tenant's right to privacy? And number 3, is a no-smoking policy discriminatory? So first, is there a legal right to smoke? No, there is not. There's no constitutional right to smoke. If you did a word search in the U.S. Constitution or your state constitution, you wouldn't find the word tobacco. You wouldn't find the word smoking. There is no legally protected right to smoke. Like, for example, in the U.S. Constitution, there is a freedom of speech. That's a legally protected right. Smoking is not such a right. So what that means is that landlords or property managers, public housing authorities, can adopt policies to restrict smoking in both the common areas and the units. And just to give you a context, landlords and property managers can have rules for their tenants to protect the property. So think about a no pets policy, or the number of people that can live in a unit. These are for legitimate business purposes to protect the property. And as we saw, smoking in a unit is very expensive and can cause damage. And so a no smoking policy is just that, to protect the property. State and local governments can also adopt laws or regulations about smoking in multi-unit housing. And this is to protect the health, welfare, and safety of the people that live there. And this is also perfectly legal to do. What about violating someone's privacy rights? We're talking about a policy or a law that is restricting some activity in a person's home. Well, the right to privacy, the legal right to privacy, is about very, very, very personal decisions, what's being protected. And to give you some examples, the right to have children, who to marry, how to educate your children. These are very personal decisions that we don't want anybody or any government to be interfering with. That's the type of privacy right that is being protected by the Constitution. Smoking, on the other hand, is not such a personal privacy right. There is no legal protection, and in fact, court cases have found that smoking is not a fundamental right and is not protected. And lastly, doesn't a no-smoking policy discriminate against people? So what we're talking about in terms of illegal discrimination is that there are certain classes of specially protected people that it is not legal to discriminate against. And these special classes of people, the way they fall into these classes, are based on characteristics that are either very difficult to change or impossible to change. So, for example, someone's race or religion or their gender. And it's not fair for people to be discriminated against because of something that they cannot change. And so that's why it's illegal to discriminate against somebody based on their race or religion or gender. But smoking is a habit. It's a behavior. It's not an inherent characteristic that somebody is born with. Now, it's really very difficult to quit smoking, but it is a habit, and that does not give you a special level of legal protection. So it is absolutely okay for a housing provider, for a local government, to adopt a law or a policy to restrict smoking in multi-unit housing. So What I'd like you to take away from this very brief overview about some of the legal issues of smoke-free housing is that smoke-free housing policies are legal. Landlords, property managers, condominium associations may all adopt policies to make their properties smoke-free. Local, county, state government can all adopt local laws or regulations to make housing smoke-free. And the real key to this is that smoke-free housing policies define where people smoke, not whether they smoke. And so that's a very important distinction. We're talking about limiting where an activity takes place, not whether or not people do it. So just to make sure that you're still with me out there, I wanted to do another poll. And you should see on your screen a question that says, how far along are you in making multi-unit housing in your community smoke-free? And again, if you could click on one of the answers there to indicate, have you started working on this issue? Have housing providers in your community adopted smoke-free policies? And that way I can get a sense of where people are in this process and tailor my comments to that. So I'm getting some responses here. I'll let the poll stay open for another second or two. And you just click on those little squares to indicate where you are in the process. Okay, I'm going to go ahead and close the poll now. And we should see the results. Okay, so it looks like most of you are beginning to explore the idea. So great, I'm so glad you're on this webinar today to learn about this issue. We have a few people who are working with their coalitions, doing some outreach to housing providers, and we have some people who actually have some housing providers who have adopted policies. Fantastic. This is great. So the next part of my presentation is to talk about different ways that multi-unit housing can be made smoke-free. And I'm going to be talking about these 4 different ways: voluntary policy, resolution, disclosure, and a smoke-free law. So I'm going to go over these briefly, and if there's questions at the end, I'm happy to answer those. So a very common way that smoke-free housing is being created is through what is called a voluntary policy. Now, when we say voluntary policy, we don't mean that the people who live there can choose whether or not to follow the smoke-free rule. What we mean by voluntary is that the landlord, the property manager, the condo association is voluntarily adopting the smoke-free policy. There's no law or regulation that's requiring them to do it. They're doing it on their own. Smoke-free policy implemented this way can cover the common areas, both indoors and outdoors. It can also include the individual units. And the way the policy is implemented, whether it's through the lease agreement, through the rules and regulations that are in place for a condominium association, whether it's through the rules and lease agreement of a subsidized housing facility, that really depends on the legal rules of your state or community. So you'd need to check in with an attorney in your community to make sure what the proper procedure is to implement the policy. And with each one of these approaches to smoke-free housing, I want to give you a sense of pros and cons, so you have a sense of how to compare them. So some of the pros of a voluntary policy are that it does protect some people. So the housing complex where the policy is implemented, those people are protected from drifting secondhand smoke. It only applies to that complex. It does educate people that smoke-free housing is a way to go, that it's a new approach to multi-unit housing. It builds support and acceptance among tenants and housing providers, and it demonstrates that it's legal. Some of the downsides of a voluntary policy is that it is complex by complex, or building by building. And if you have a large city with many, many units of multifamily housing, this could be very time-consuming. The other thing to be aware of is that with a voluntary policy, if the building is sold, for example, if it's an apartment building, or if the condominium association decides to have a change in their rules, the smoke-free policy can be fairly easily changed. And so the building would then be just regular, and there'd be smoking and non-smoking allowed. The next way to go about making housing smoke-free is through a resolution. And that is the elected body, so say the City Council or County Board of Supervisors, decides to adopt a resolution saying, we really encourage landlords and condominium associations to go smoke-free. We are not requiring you guys to do that, but we think it's a great idea, and we really think you should do that. And that's really a great way to go. Here are some of the pros and cons. It really increases visibility for smoke-free housing. A lot of times it's connected to an awards program so that landlords or condominium associations that do adopt a smoke-free housing policy get recognized. There might be a nice news story. It's a way to heighten awareness of the issue and to educate people of the need for smoke-free housing. It also rewards first adopters, and those are the people that are kind of out in front, really trying to do something innovative and progressive, and it highlights and rewards them. And usually there's very little opposition to a resolution because it's not required. We're encouraging you. We think this is a great idea, but you're not forced to do it. On the flip side, because it's not requiring anybody to do it, people might not do it, so it doesn't mandate any change. And potentially it can use up your political capital because, like I said, it's an elected body that is adopting the resolution. So if you are in there talking with your city council member, your board of supervisor member, encouraging them to do this, and then you want to come back to them later about the same issue to adopt a local law, they're going to be like, hey, but we've already done something about smoke-free housing. Wasn't that enough? So you want to be thinking strategically about whether a resolution is the right way for you to go or if you want to go all the way for a smoke-free housing law. And I'll be talking about that in a moment. Another way to encourage smoke-free multi-unit housing is through disclosure. And again, that is something that a local elected body can adopt or a state legislature can adopt, a law that says to housing providers or people who are selling condominiums, what you need to do is you need to tell people where smoking is allowed. We're not asking you to restrict smoking. You just need to inform people before they move into the building where smoking is allowed. And I don't know if you all are getting these sorts of calls, but I've gotten these all the time. Somebody moves into a new apartment building, smoke is drifting into their unit, and they tell me, if I had only known that there was someone who's smoking living next door to me or living below me, I never would have moved into the building. And that's what disclosure is about. It's telling people before they sign their rental agreements, before they buy their condominium, that, hey, smoking is allowed here. It's allowed everywhere, or it's not allowed in the common areas, but it is allowed in the units, or it's allowed on the third floor, but not on the first two floors. So people have information before they move in. So that is definitely one of the pros. It gives people information before they sign an agreement. And it also, what we found is that it encourages people to adopt smoke-free policies for their entire building because they become aware of, oh, you mean I can do that? I could make my entire building smoke-free? That's great. I'm going to do that. The cons of a disclosure policy are that, again, you are not requiring a smoke-free property. You're just requiring people to tell others where smoking is allowed or not allowed. And the other thing is that it doesn't help current residents. It only informs people who are going to be moving into the building and signing a new lease agreement or buying a condominium for the first time. People who are already in the building, who've signed their agreements, they're kind of stuck. Now, the last one I want to talk about is smoke-free housing law. And that is adopted by local government or state government, and it is a mandate to go smoke-free. It can be for the common areas, both indoors and out. It can be for the individual units and balconies and patios associated with those. It can cover all types of multi-unit housing, market rate, senior housing, subsidized housing, condominiums. It can include different sizes of buildings, 2 units or more, 4 units or more, 15 units or more. And it can also include existing multi-unit housing or new multi-unit housing. And this is the approach that California is using, and there have been, I think, almost 25 communities now that have adopted smoke-free housing laws, and they are really being implemented quite well, both in Northern California and Southern California. Some of the pros of this approach are that it can apply to all the multi-unit housing complexes in a community, within that city, within that county. It does require a change. So it does require housing to be non-smoking. It's a long-term policy solution because a smoke-free housing law takes a while to get adopted, and it would be very challenging to get it repealed. And the other piece is that a smoke-free housing law, if drafted well, has many different ways to enforce the law, so that if somebody is smoking where they're not allowed to, there are different ways to enforce the law and make sure that people are following it. Now, some of the cons are that it is likely to be opposed, and this is a new policy area, and people aren't sure about it. They have concerns about it, and what we've found here in California is that there is strong opposition at first. What we found with the first few policies that were adopted, there was very strong opposition, but now, 4 or 5 years into this sort of work, really there is very little opposition. It's quite astounding. People are very happy with smoke-free housing. They know the dangers of secondhand smoke exposure, and they really want to do this. The other thing that I'd like to mention is that the policies can be complicated. There's a lot of legalese, and it can be a little complicated. So what I'd like to highlight for you is some of the resources that we have on our website and that we'll be sending out links to you all. We have many fact sheets about smoke-free housing that go into more depth about a lot of the things that I've covered today, as well as a model law that was designed for California but that could be adapted and customized for your communities. So with that, I am going to open it up for questions if you'd like, and you would just type those in the chat box. And Leslie, have there been any questions while I was speaking?
Yeah. So thank you, Robin. We had a couple questions. One is it's really kind of asking about the different areas that you can make smoke-free. So you mentioned this briefly, but an apartment balcony or patio, would that be covered in either a landlord policy or a local law?
Yeah, exactly. So yes, balconies and patios can definitely be included. We've seen it done a couple of ways. One is the law or policy could just be about smoking on balconies or patios. Another way that it's been handled is the law or policy can say no smoking in the units, and that includes smoking on the balcony or patio associated with that unit. So yeah, smoking on balconies and patios can be included in a smoke-free policy by a landlord or a condominium association or a smoke-free law. And
there, go ahead.
And some of the other areas that are can be covered by a smoke-free policy are indoor common areas, so hallways, elevators, stairwells, lobbies. Those can all be included, as well as outdoor common areas, parking lots, if there's a pool, by the pool complex, picnic areas, those sorts of outdoor places.
And we had a question that was really quite related to that. The person was asking, since in most places you can't smoke in common areas if it's indoors, but say in a building you can still smoke in individual units, is there anything you can do to regulate the smell or the drift of smoke? Because in some cases the hallways still smell like smoke even if no one is standing actually in the hallway.
Right, right. And that is a challenging one because they're not supposed to smoke in the hallway, but they're smoking in the unit and it still is drifting out. And really the best way is to do a smoke-free units policy. One thing I did neglect to mention is that for the voluntary policy and for a smoke-free housing law, what we found is that some landlords and some laws allow a designated outdoor smoking area, outside in the common area, away from the building, so that people who smoke still have a place to go to smoke, but it's not inside. It's not drifting into neighboring units. It's not exposing their family members. And so having a place where people can smoke to go outside, away from the building, is really a good approach.
Great. So I think that does it for now. I know that Diane and Kylie are going to be addressing some of the other issues raised when people ask questions signing up for the webinar. So why don't we go ahead and move on?
Great. So I'm going to ask another polling question before Diane and Kylie get started. And you should see this one on your screen. And this one is, what do you think is the most persuasive reason for a housing provider to go smoke-free? What do you think will be very influential for them as you're starting to go out into the field and talk to landlords, talk to housing authorities, talk to condominium associations? What do you think will be the reason that they want to go smoke-free? I'm getting some results in. I'll leave the poll open for another couple of seconds here while people click on those buttons and then click Submit. Okay, I'm going to go ahead and close the poll. Wow, very different results this time than from the first poll. So number one answer, reduce property damage and cleaning costs. So that was the number one. Number two was attract and retain tenants. And then the last one in the poll was avoid landlord liability. Great. Thank you so much. This is really interesting results compared to the first poll. So Diane and Kylie, I'm going to turn it over to you. Do you want to go ahead and advance to your slides?
Sure. This is Kylie, and thank you for doing the poll. we are going to be talking a little bit about some opinion polling that Diane and I conducted in Oregon, and so we'll come back to that and talk about what we found to be the most persuasive. But just to get us started, Diane and I are going to be speaking about some techniques and strategies that we in Oregon used to start our campaign. I'm with the Reed Group currently as a project director, and Diane Lauder is with Health Insight, LLC, and our contact information will be on our last slide. But Diane and I have worked for years to address smoke-free housing using many of the strategies that Robin discussed in her presentation. The presentation today is going to focus on what we've done around promoting voluntary private policies among housing providers, and also a lease disclosure law that we were the first state in the nation to pass. So these are going to be some steps that we've followed to get started, and many other communities around the country have used similar steps. So we understand that every context is different. Every community is going to be starting in a different place when you're working on smoke-free housing. You'll have different kinds of partners, different players in the room. So we really encourage you to think about this as a recipe with ingredients that you might replace depending on what you have on hand. But a lot of these are going to be strategies that we hope you'll consider utilizing when you're getting your campaign started, of course with your own special twist. So as we're talking about what we did, please think about how you can apply that to your situation. The very first step that we found to be important and that has proved to be important across the country is to form an advisory board. And this isn't the typical tobacco prevention or public health coalition. This would be a board of people or a group of people, you can call it whatever you want, of people who are from the housing industry. And we really focused on developing partnerships with the landlord trade associations. There are usually professional associations in any community. The tenant rights groups, so in Oregon we had a group called the Community Alliance of Tenants, and we worked with public and affordable housing agencies like our local Portland Housing Authority, state agencies, and the Fair Housing Council of Oregon. And these partnerships proved to be very critical through all sorts of phases of our project. And the way we did that was to meet with individuals one-on-one and ask them questions about what they were hearing about smoking in housing and secondhand smoke, and what they thought we should do about it. So we really enlisted them as advisors and put them on the same side with us rather than as an audience for our advocacy that we were trying to come and knock on their door and get them to change something immediately. We really enlisted them as colleagues and advisors. We also gave them opportunities for input when we needed them, and we didn't make them come to individual coalition meetings, but really used a model of meeting one-on-one with occasional group meetings that were really focused on specific decisions that needed to be made. Another arm of our first steps was to gather information on what was happening nationally, just as you are doing with this webinar, the work you're doing with public health law and policy, getting a sense of what has been successful around the country. And I can't emphasize enough how critical it was that we hired a professional research firm called Campbell DeLong Resources to do our own market survey of tenants, as well as landlord focus groups and interviews with key informants who were leaders in the housing sector. A lot of times surveys have been done in other communities, and even though we know the trend in the results is going to be the same, our landlords here really want to know what people in Oregon think, what renters in Oregon think. They don't want to know what is going on in California or what the opinions are in Washington. They want that local data. And so we encourage anybody who's starting to work on smoke-free housing to get a sense of what the local market demand is. And we have a survey tool that you can look at that we can provide a link to. We also did the qualitative research with landlords at the focus groups and the key informant interviews. And these are some of the key things that we learned from landlords. Like you said in the poll, the turnover cost was a huge problem. They knew smoking was costing them a lot of money in cleaning and maintenance. But what they weren't sure was whether it was legal to adopt no smoking policies. And they also weren't sure if people who rented would want to live in their building if they were smoke-free. They were really nervous about losing potential renters. They thought that they would be turning away a big sector of the market. We also found that protecting renters from secondhand smoke was not at all a motivator for them to change. And these were interviews and focus groups with landlords who had already adopted no smoking policies and those who had not. So we got both perspectives. But what we really found was getting them to tell stories about the horrible turnover and cleaning and maintenance and expenses that they had to pay for because of smoke damage was a great way to get them on board and excited about the topic. But what they really needed to persuade them was that they had a big market demand, and that's where that renter survey came in. So what we decided landlords needed, based on what they told us, was they needed to know the no smoking policies were legal, and they needed to know the market was there for them. They also needed very simple steps and tools to describe how to go through the process of adopting a policy. And they wanted materials with a business-like layout and look. And so this Landlord's Guide to No Smoking Policies is an example of one of the materials that we created. It was a booklet that described the policy steps. And I'll tell you, the secondhand smoke information was half a page on a very last page because we knew that that was not going to be persuasive, but we still wanted them to have that information. The reason we focused on landlords instead of trying to organize an advocacy group among tenants was because landlords are in charge of the system. They're in charge of the housing system. They're in the position to make the desired change. And we felt that that would result in more renters being protected faster. As Robin was talking about with voluntary policies, you can get entire complexes to go smoke-free. But what we learned was that most times complexes are owned or managed by property management companies that own many, many complexes. One of the first companies that we worked with to adopt a no smoking rule actually resulted in a policy that protected 6,000 people because of the number of properties that they owned and managed. So you really do have potential for a great deal of breadth. So landlords make the change when it makes business sense for them. It was going to positively affect their bottom line. Not only will they save money on cleaning and maintenance, but they'll also attract tenants and be able to retain them longer. So those are the most persuasive messages. We also found that it needs to be endorsed by their trade associations, and it was so critical to work with the professional groups here in Oregon, and Diane will be talking much more extensively about the different things that they did on behalf of this campaign. It was also important for landlords to be aware that their colleagues are doing it and having success, and that's where publicity comes in, particularly in the trade journals and business sections of the paper that they are reading. That it's important to have tools and support that make it simple. And at least here in Oregon, because of where the political will is regarding no smoking rules and the smoke-free workplace law, we found that it was much more persuasive and we were going to get more traction and be able to protect more renters from secondhand smoke if we focused on it as their choice as opposed to being forced on them by government. We found that the professional associations were very supportive of the work we were doing because we were promoting voluntary no smoking policies in multi-unit housing rather than trying to get a law passed. That was our political context, and yours may be different, but these are just some foods for thought. I'm going to turn it over to Diane now.
Hi, thank you. Good morning, everybody. I just want to give you a little bit of background about the project, and that is that when we first started this project, it was coming up on 8 years ago. I was working with the American Lung Association of Oregon, and Kylie was with the county health department that is the Portland city, the county that Portland is in. And we really started the project as a metro. It's the big metro area. And 3-4 years into that, the state looked at the project and said, oh, this is really moving. Some things are happening here. We should take this project and have all of our counties start working on this. So they made it become best practice objective that was required. And it was at that point where I left the Lung Association and I got a contract with the state to provide technical assistance to the county health departments as they started doing this work. So kind of have done it on both levels. And a lot of the counties, when they first started, were in the same place that I think a lot of you are. It's like, I don't know this industry. I don't know how to talk to them. I don't understand. You know, they're subsidized and all these different things happening, and I don't really get it. And I'm feeling really uncomfortable because these aren't my natural partners. And so what I tell people is it really works to figure out in your community who's who. And if you can find a community navigator or just anyone who will talk to you to start with, these people all know each other. And what I really recommend, I think it's magical, and if your counties will let you do this, is to take people to coffee. You know, you're talking about $6 or $7. You usually get, people say yes. You get an hour of their time, and they're very friendly towards you. And that really worked for us. So that's how we started. We didn't know any of these people, and we sat down with them and really asked, who do you know? What do you think? And not only did we get the information, but we started developing friendships. Did I just get cut off?
Nope, we can still hear you. You're great.
Okay, good. Because I'm getting a message here. I don't want to fix it.
We can advance the slides for you if you are.
Okay, perfect. So I just really recommend just getting started, finding out who's who in your landlord world. There are usually a number of different trade associations, and there may be some that serve the big property management companies. There may be another one that serves sort of the mom and pop landlords. There may be several that serve the affordable housing community. I know there's NARO, the National Association of Housing and Redevelopment Officials. NARO serves the public housing. And you may have one that serves the community development corporations or the nonprofits. So really check into all of that. As I said, these people all know each other, and once you get in the door, they'll often help you open the doors to others. So we were really, obviously we wanted to get as many properties to adopt no smoking policies, but we tried to do this by changing the landlord culture. We understood that we need to change the culture here. So it's the next slide now. Oh, changing the landlord culture. Can you hear me?
Yeah, so you are on the changing the landlord culture slide. Go ahead.
Yes. Okay, so yeah, I've lost my connection here. Okay, so within the landlord culture, there are all these different trade associations that I mentioned. I'm sure that you've got those locally. And this is where landlords go to get their information. They're trusted sources. They often have trainings, they have conferences, they have monthly luncheons, they have newsletters, they send out emails to their listserv. And so if you can work with these folks to get your messages incorporated into what they're doing, this is a trusted source of information, and it's just really valuable. And one of the questions was about advertising. Often this is free advertising, and it's the best advertising because it goes right to the target. Another thing we did was we were really working to try to make smoking be part of what they do, and making it be a standard feature of the model lease forms. Many of these organizations sell forms to people, and so this is a great place to have an impact. And I'm going to show you on the next slide. There's a rental agreement from Oregon. Another thing that we did is Robin mentioned this too, we took the stories of the people that were the early adopters and we really featured and highlighted them. And I think that they all watch each other, and they trust each other, and so this is the most powerful thing you can do. When I try to make fact sheets or any kind of information pieces these days, I really try to tell my story using quotes from industry folks. I think it's a lot more powerful than having it come from public health. And in fact, when we did our landlord focus groups, they were asked, who do you trust for your information? And of course, the biggest one was their landlord trade association groups. And they said, well, do you trust the government, public health? Do you trust the lung association? And they said, well, not really. Those people are paid to say that stuff. So they're looking to their trade associations to make their business decisions. And that's why I really encourage you to go and work through those venues. And highlighting their success makes everybody look good and feel good, and then they kind of get the picture that, oh, this can work for me. This is great. I know that in public health there's a lot of, let's say, emphasis on really working to help disparate populations, and people might be tempted to really start with public housing and low-income folks, but we really worked with the whole market, and I think it's important because, as I mentioned, these folks all watch each other. Guardian Management is the biggest private property management firm in Oregon, and they're in a lot of other states. And we worked with them to adopt their no smoking policies. They did a really good comprehensive one, and everybody watched them. And because of that, the Housing Authority, who had said, we're not doing this, we have too many smokers, this is just never going to happen, watched that happen and went ahead shortly after to adopt their own comprehensive policy. So I think that the whole market, working with the whole market and working with doors as they open to you is really important. Another thing is that we really want to encourage landlords to feature no smoking in their ads. This is really part of a culture change too, having them, when people go on to find places to rent, when they start seeing no smoking everywhere, that's a good culture change. Okay, next slide, the rental agreement. So this is an example of a rental agreement. This is Metro Multifamily Housing Association. They probably sell the most forms to the most, just private landlords, mom and pop landlords. And see here how there's a place now where it's telling the smoking status. They also have a little bit more of a detailed smoking disclosure form. But this is exactly what we were going for, trying to make this be part of the landlord-tenant dialogue. Okay, next one, the website. So this is a website. You can go to this website. It's our project in Oregon and poke around here. This website is really designed for housing providers, for affordable housing, landlords, condo associations. We're starting to work with them now too. So this is the smokefreehousinginfo.com. And again, on this website, there are a lot of examples of real lease language and things that were created by industry folks. Rather than having it come from the health, it really comes from Guardian or comes from Housing Authority of Portland. And I just think that's really powerful. Okay, next slide, creating policy change. Now, as Kylie mentioned, we were the first state to go ahead and get a landlord or a smoking policy disclosure law passed. And I know that there are other communities that are moving ahead. Maine has one now. New York City, Buffalo worked on one, and New York City is. I think this is it's a great thing. I would not start with this. I think that this, well, number one, the reason we were able to get this law to pass is because of the years we had been already working with the landlord trade associations and all of these folks for 3 years and really had built up a lot of trust and partnership. And so we went to them, and we have an opportunity our legislative session is every other year. And the Health Division has an opportunity to put, what are they called? Concepts, legislative concepts and they can give those to the governor's office, and the governor's office can adopt or not adopt. And that year, they went ahead and adopted the idea. There was some language in there, and it said that landlords will be responsible for warning people about the dangers of secondhand smoke. And our landlord partners did not like that. They said, this is just another, another hassle for us. I don't know if you're aware of this, if you've been a renter or you are a landlord. They're required to notify their tenants about lead and the smoke alarms. There are a lot of things that they have to do, and this started looking like they would balk. So we said, that's fine. For starters, in Oregon, 97% of the population know that smoking, secondhand smoke is a hazard, and that's fine. So we took that language out, and we were just thrilled when the trade associations, there are two of the big ones, they said, we'll put our lobbyist on this, and we'll actually lobby for this. And so it just sailed through. Almost nobody voted against it, and it became law. And what was great is we pulled in those same housing industry partners. We had a luncheon, and we had them come and identified all of the different communication channels and ways we could message about this. And then, there's a lot more details about that, but we use this opportunity to educate and let landlords know in just every way we could think of. So go to the next slide. It's the landlord postcard. Just to kind of show you, this was one of our tools, and this went out to, I think, 35,000 landlords. Somebody asked a question about how can you identify landlords, and I'll give you one answer to that. I mean, you can open up your yellow pages, and a lot of times that's one way. But if the county tax, our taxes are collected on the county level, property taxes, and so we can go to the county tax office, and there's a way where they can sort, and they can, if the address of the property is different than the address where the tax papers are going, which kind of indicates that the person doesn't live there and this may be a landlord, that's a way where they can do a sort and can pull you a list of potential landlords. I think they're also able to pull lists based on the number of units. If it's 2, or you might not be able to sort out the single-family homes that way, but you might be able to sort out the multi-unit. So that's one way you can start, and it may be free to get that too, especially if you're with county government. Okay, so the next slide about creating sustainability. We're not going to be there forever, and we want to make these things stand on their own. And so I think probably the best thing we did, again, was work through these landlord channels. It's up on their websites. It's part of their tools. It just becomes part of what they do. Kylie mentioned the Fair Housing Council, and I don't know if you have a similar organization in Illinois, but they're the people that have the contract to enforce the fair housing laws. And here in Oregon, we were really lucky because they do tenant outreach and they do landlord outreach, and they were well viewed by both. Sometimes there's some kind of negative energy going on between the landlords and the tenants, but this group was really respected and seen, liked by both, and that was super helpful. They became a good partner for us, helped us navigate through the system, and helped us with education. And they actually took on a lot of the handling the tenant portion of this. They're used to getting complaints and things, and so that was a really nice, we gave them some grant money to do some of that work, and that was a really great partnership. And then there were a lot of different housing directories and listings, and we worked with them to incorporate maybe a search criteria about smoking. So really, instead of creating our own Smokefree Housing Directory, which is very time-consuming to keep up, we really tried to work with the existing things. So next slide about the housing world is interconnected. And I kind of made this point a little bit a few minutes ago, but this world is very interconnected. And I think getting buy-in and weaving messages through the different sectors, it can really change the cultural landscape and can have impact. So let's just say you go to your public housing and they fold their hands and shake their head like ours did at the beginning. They're not going to do it. So they're not going to do it right then. So it's important to kind of back off. You can give them information and keep a friendly connection going, but then move ahead with some other sector. Start working with the private market rate properties. And many of these handle thousands and thousands of units. So if you get a big property management company to go, like we did with Guardian, and I bet in Illinois you have some huge ones, you've protected a lot of people. Oftentimes these private companies also manage public housing and affordable units. So through their doing that, there'll be a sort of a spillover effect on that. And I think that, so just walk through the doors that are opened. Obviously I talked about these organizations that serve and support landlords. Realtors is another creative way that you could work, because realtors, if you think about who they are in the community, they're connectors. They make it their business to know everybody. They're also trying to get that low postage rate, and they send out things. So they're always looking for information that's of public value. And so I think that there may be some opportunity there to have them work with you. And up on our website, there are some tools that you can go to. I think it's called Selling, or I don't remember exactly what the tab is, but there's some tools that we developed to work with realtors. Condo associations, over the last couple years, and this is maybe not the first step, but we've worked our way into a trade association. It's called Community Associations Institute, or CAI. It's a national organization that serves that world, and we're starting to make some progress with getting those people. It's all the attorneys that serve that world. They're called community managers, and really having them be comfortable with this idea and giving them the tools to move ahead. So it's all interconnected. And then just, okay, next slide. Now, I just wanted to make a point. We talked about what would motivate landlords, and I think that you were right in the polling that people are really, they know this is costing them a lot of money. And honestly, that's the bottom line for these guys. This is a business for the private people. It's a business. They want to attract people, but that's really what they're about. When you start talking about affordable housing providers, there are different motivations there. It's really a different thing, and I think that though they care about all that, these are kind of more of a social work mentality. They're not in it for the money. They're really trying to help people. And these people in Oregon, and probably elsewhere too, 5, 6 years ago, were really on the page of, oh, these poor people, smoking is their last pleasure, and we just can't take this away from them. And I think they weren't thinking about the fact that probably somewhere in their mandate it says that their job is to provide safe and healthy housing. They weren't really framing it that way. So it's our job to really help them think about that their job isn't to help that lady smoke. Their job is really to provide safe and healthy housing for everybody. And as I've mentioned before, they respond to changes in the landlord culture. One of the things that can really help with public and affordable is for you to get in and help them do tenant surveys. We've got a lot of tools up on our website. I know lots of people have used this. And I think even though you know what the results might be, this is kind of like a vote. And every time we've done these surveys, they've been, even years ago, because it keeps going up, 60, 65, 60, between 60 and 70%. Well, here in this country, that's a majority. And I think that for them to go through that process, and then they can say to their residents, you voted. We have a huge overwhelming support for this, and I think that's really helpful. And it's something that you as public health folks could really help them provide. They may not have the time for this. They're very overwhelmed. That you could really step in and help move this along by doing that. And then another thing too is that there are a lot of smokers. They know that. And so really stepping in and helping them provide support. I don't know if you've got quit lines or anything you can do to help that. Okay, just last slide is the next one about measuring success. Some of the things we've done in Oregon is, it's hard to measure success, but we added some questions on the state level to the BRFIS about 3 years ago, and so we're able to, in fact, there are questions that are very similar to the ones that John Campbell asked in our basic landlord, our baseline research. So we're going to be able to track over time, basically, are you aware that your landlord has a policy, a no smoking, or a smoking policy? And so we can track that. One of the things I've been doing on the state level is keeping track of what's happening in certain defined groups, like the housing authorities, the tribal community development corporations. These are groups that you can identify who they are and then kind of keep track of what's happening. In Oregon, 3 years ago, we have 22 housing authorities, and 3 years ago we had one that had a no smoking policy, and now 20 out of 22 have one, and 14 of those are complete comprehensive policies. So this thing, when it starts to move, it moves like wildfire. So, and one last thing that we're doing is, it's kind of messy, but we're looking at Craigslist and counting up the ads. You can do a sort, and counting up the number of ads on a given day. We do this quarterly. And then how many of them say words like no smoking, smoke free. This is kind of a, like I said, it's sort of dirty, but it's a snapshot of who is advertising and might help you sort of track the landlord culture. So that's the end. We have obviously a lot of things to talk about, but this is kind of it in a nutshell. And we can answer questions too.
Great. Thank you so much, Diane and Kylie. That was really practical advice, and it's really helpful to hear from someone who's been there and tried things and found what worked. We do have a few questions. One person asked about working with the large property management companies. Sounds like you definitely have had some success. Did you get some pushback from the companies? For example, were they willing to change only a few buildings, or did you find that they were willing to go entirely smoke-free when you approached them?
What I've seen is a lot of times these companies and even affordable housing, they'll say, oh, we're going to do 3 buildings or 3 properties or whatever. And then they start going down the process and they go, you know what, we're just going to do the whole thing. And I think that's works a lot. And also, I think getting them started down the path, they're going to love it, they're going to do it. And so by saying, well, that's not a good policy, you should really do everything, I'm not sure that that you may be wasting time doing that, because as they move ahead, they're going to love it. They're going to become used to the enforcement, and they'll get that down. So, I think that I don't think there's been a pushback, no.
Mm-hmm. Great.
I agree. And I think a lot of times they'll set it up as a pilot project, and then they'll see that it's working so well, they'll go ahead and take it out, over their entire system. And something related to that that we didn't mention in the presentation, but we have focused a lot on working with people who do landlord trainings as part of their job. And one of the things that we have them ask during their presentations is to get a raise of hands of how many landlords or property managers have gone smoke-free. A whole bunch raise their hands, and then they ask, have any of you ever gone smoke-free and then gone back? And nobody raises their hands. And so they can see they've done it, they like it, they're sticking with it. And that's a good pure norming strategy. And speaking of polling, something else, we didn't give you the number, but when we did our market survey of the renters to see what their demand was to live in smoke-free housing, we found that about 3/4 of renters would prefer to live in a building that was entirely non-smoking. And we also asked them if they would pay a little bit of extra rent to live in a smoke-free building, and over half of them said yes, that they would pay extra for that amenity. And while we don't promote the idea of raising rents for the privilege of living in a smoke-free building, it's really an influential number because it shows landlords how strong the desire is for this amenity.
Great. That's really helpful. I thought it was so interesting how you guys were able to use the kind of buzz to get people and other property managers to follow the trend. Robin, do you have anything to add from the experience in California with adoption of local laws in terms of how much housing to cover? Were communities willing to say, oh, we're going to make all of our apartments smoke-free, or did they do something more gradual?
That's a really good question, Leslie. What we found is there's a difference between the communities that were the first adopters, first out of the gate, and those that came later. so kind of this pilot project idea of, well, we'll make 50% of the units non-smoking or 75% of the units non-smoking. And those were some of the first laws that were adopted. Later on, it was, we're going 100% because, for two reasons. One, they had heard from landlords who had adopted their own smoke-free policies, and landlords were saying it's much easier for us to manage a smoke-free policy if all the units are smoke-free. Then we don't have any arguments or complaints about, well, why is Joe in 5B, why can they smoke, but Alice in 6C can't smoke, and who's smoking? Excuse me. And so it was much easier for landlords to go ahead and do it 100%, and they were able to give their elected officials that information. And then we've actually had at least one community who started at 50% and has gone back and changed their law to make it 75%.
Interesting.
So that's really interesting.
Yeah, it sounds like there are a lot of methods of entry into the issue.
Another thing, too, I want to mention that you may hear from the housing industry that they'd like to grandfather folks in, and you may get this more in affordable or tribal housing. And grandfathering is really a big mistake because then the building, you may have 3 people on the property that are smoking inside their units. Well, you don't have a smoke-free building then. And if you grandfather those people, for perpetuity, then what? You've got people that are living next door to them, and it's really hard to enforce that and keep track of it. So we really recommend just go for it.
Well, something related.
Let's do Kylie first, and then Robin.
Okay, thank you. Something related to that is, and you would need to check with your local and statewide housing laws, but tenants may need a certain amount of notice, such as 30 days, for any changes in their lease. And so there are different options. They can be given whatever the required number of days of notice is before the change goes into effect, or the change can go into effect as individual leases turn over. So as they turn over the course of a year, the policy will be phased in for the whole building. Or potentially there can be a certain date that the entire building or complex or series of buildings will go smoke-free. And some of that is dependent on your housing laws.
Yeah, and this is Robin. I was just going to add also, I think, for smoke-free housing law, I think that the phase-in period has given more comfort for these types of laws. And so this is addressing the problem of, well, what do we do about current tenants who smoke? And so a smoke-free housing law, or as Kylie was saying, a voluntary policy, could be phased in either over time or at a date certain in the future. And that gives people a sense of, well, we can do education about the policy. We can do cessation counseling. If people choose, they can move then and get out of their leases. So there's a lot of different options in implementing the policy that makes it go much more smoothly.
Great.
And this is Diane again, and I would recommend taking the time. There's no reason to rush this. Just taking the time and really doing a good job of education, making sure everybody knows, can really help against backlash.
There was another question which I personally don't know the answer to, but one of our speakers may, is there a way to find out what number or percentage of apartment complexes have decided to go smoke-free if there isn't a law in place?
It's really difficult to measure.
Yeah. It sounds like definitely anecdotally you can get that information, and those people can be spokespeople for other landlords.
Sure. Or doing a survey maybe through the Landlord Trade Association of their members. You could find out what their policies are. That might be a place to start.
And I know in California, our California Apartment Association, which is the trade association for people who own and manage apartments, they've recently changed. They have a model lease form, and it's similar to what Diane and Kylie showed. They've changed it so the default is that the apartments are smoke-free, because the Apartment Association was hearing increasingly from tenants that that that's what they wanted, and landlords were trying to respond to that demand. So that also helps it if the default lease form creates entirely smoke-free units. So another question that came up, and I know all of us get calls on this, is if a community doesn't currently have a law to create smoke-free units. I know that we all get calls from people who are currently affected by drifting secondhand smoke. And certainly Diane and Kylie talked about the importance of making quit resources available for people who do want to quit, but what has been your experience, or what do you tell people who are in a situation where they're currently being exposed to drifting secondhand smoke?
Would you like me to take that one, Leslie?
Sure, Robin.
So I'll jump in, and Diane and Kylie feel free to respond. So it's so heartrending to hear these stories about people being affected. Maybe they have a baby, maybe they're pregnant, maybe they're a cancer survivor, maybe they have no health effects right now, but it's just so awful to be living in that sort of situation. And so there are some legal remedies. They are less than ideal, let's just say that, where it does require the tenant being affected to institute some sort of legal action. We have on the Public Health Law and Policy website, and in the resource list we'll be sending out to you, we have a fact sheet about what tenants can do about drifting secondhand smoke and what condo owners can do about drifting secondhand smoke. It's written based on California law, but I think it's analogous to other states as well. And it goes through some of the legal claims that a tenant could make against either the neighbor who's smoking or the landlord. But it's a very less than ideal way to resolve the problem. Obviously, it's expensive. The laws are not drafted to suit this particular case. We're kind of using them as best we can, but it's not ideal. So what we really recommend is there a way to talk with the person who's smoking? Is there some sort of mediation service available in your community that you could have a third party help negotiate a resolution? How involved could you get the landlord to be? And then, unfortunately, in a lot of cases, it just is you need to move. If you're really getting sick, if you're concerned about your health, unfortunately, at this stage, if there's no smoke-free policy, either by the landlord, the property manager, or the local community, it's just so difficult. You could also talk to your landlord or condo association about adopting a smoke-free policy and giving them the information that we've talked about here, because they might not yet know that they could do that.
Thanks, Robin. Yeah, we've definitely seen that that people who are most affected can help. Definitely, they might be able to join your coalition or help advocate for a smoke-free law, because, as you said, Robin, these stories are just really difficult. Kylie or Diane, do you want to add anything?
Sure.
Yeah,
when we
ahead.
first started our project, we were getting a lot of calls from these folks, and it's very time-consuming. It could be a 45-minute call. A lot of times they have a lot of other issues going on, and so we finally realized that there was really nothing we could do to help them individually. And it's right. They need to, there's some tools. They need to document all of the correspondence with their landlord and really keep track on, send letters in a certified way and all of that. So there were some tools that we developed for them to do that. But we realized that spending a lot of time on individuals probably isn't getting us where we need to go. And we really, we can do a lot more by going and spending our time working up on the systems level. We may not protect that person right away, but a lot more people will be protected in the long and short run. So that's kind of, it may sound a little callous towards that person, but really, that's kind of what public health is, I guess, more systems approach.
It's
right.
true, and
Great.
a couple of a couple of concrete examples of how we worked with systems to try to create more support for renters in these situations was through working with the tenants, the Community Alliance of Tenants, which is a tenants' rights advocacy group, and we really educated them quite a bit about what the different laws were that could be used to protect tenants and what the issues were around their rights. So if they got a call from somebody or we referred them there, they could get good advice from them, because that really is the system that exists to help tenants, as well as the Fair Housing Council. And through some contract money that we were lucky to be able to do with the Fair Housing Council, we set up a smoke-free housing hotline. So renters who are in this situation could call and talk to an expert at the Fair Housing Council and see if they qualified under fair housing laws to be able to request reasonable accommodations. So under the Americans with Disabilities Act and the Fair Housing Act, people who have a true disability can request reasonable accommodations, which means that they can have equal access to their housing. And if they have a disability that is, legitimate disability and is affected by the secondhand smoke, that's an avenue that some people have been able to take. But again, it takes a lot of work and a lot of resources. And so focusing on just trying to get as many housing managers and owners to adopt a no smoking rule is the best way to protect people in our experience.
Great. Well, that's a perfect way to end it, bringing things back to all of the benefits of broad-scale policy change. As Diane said, that's really what public health is about. So we are out of time here. I want to encourage people, if you have questions, please contact Claudius Isfan, who introduced today's webinar, and he can direct those questions to us at Public Health Law and Policy, or direct you to resources within Cook County to help answer your questions. We're also available. Here is our website. And I want to, again, thank all of our speakers, Robin Salzberg, Diane Lauder, Kylie Mina Johnson. Thank you so much for providing this information. As we said, the webinar will be available for downloading and the slides on our website in a couple weeks, and we'll be sending out an email with some additional resources, including some of the sources that our speakers referred to today. So thank you all again for joining us, and have a good day.
Okay.